Let's see about recurrent abortions. And these recurrent abortions is also called as recurrent pregnancy loss, RPL. First, the definition of recurrent abortions is when there are more than or equal to 3 consecutive pregnancy losses at less than or equal to 20 weeks of gestation, or when the fetal weight is less than 500 grams. So, more than or equal to 3 consecutive pregnancy losses at less than or equal to 20 weeks of gestation, or when the fetal weight is less than 500 grams. This is the definition for recurrent abortion. The etiology for recurrent abortions will be, first is any parental chromosomal abnormalities, genetic causes, then the uterine causes, which include congenital malformations of the uterus, cervical incompetence, etc. The other etiologies will be the immunological factors, then the autoimmune factors, which include antiphospholipid antibody syndrome, APLA syndrome, or there can be any inherited thrombophilias, or maternal diseases like diabetes mellitus. These are all the possible etiologies for recurrent abortions or recurrent pregnancy losses. So, now we will see about the counseling and investigations which we will do after recurrent abortions. Even though the definition says that more than or equal to 3 consecutive pregnancy losses is defined as recurrent abortion, but it is better to start counseling and investigation after 2 abortions itself. Since the pregnancy loss is very high after 2 losses. So, in that, first we will take a detailed history which plays a very important role. The history is taken regarding the pregnancies which resulted in miscarriage or abortion. Next, we will do certain investigations depend on the gestation at which there was pregnancy loss. Some of the investigations include karyotyping. If there is recurrent pregnancy loss in the first trimester, that is also called as early abortion, and investigations for cervical incompetence, and uterine malformations. If there is any history suggestive of them, and we should rule out the autoimmune disorders like the APLA syndrome, antiphospholipid antibody syndrome, and we should screen the mother for comorbidities and other infections, comorbidities like diabetes mellitus, and screen for syphilis. Then the third point would be, we will give certain advices regarding future pregnancies. For future pregnancies, any abnormality if present should be corrected before planning for pregnancy. And the female should report to the specialist as soon as the pregnancy is confirmed, because they can require treatment in conditions where there are autoimmune diseases like antiphospholipid syndrome, or if the patient has diabetes, they should be diagnosed and treated earlier. And those women should receive antenatal care in high risk pregnancy clinic, and delivery should be conducted in a center with all facilities for both the mother and the newborn. So this is about the recurrent abortions or recurrent pregnancy losses. It is defined as more than or equal to 3 consecutive pregnancy losses at less than or equal to 20 weeks of gestation, or the fetal weight is less than 500 grams. The possible etiologies include parental chromosomal abnormalities, uterine causes like malformations and cervical incompetence, immunological factors, autoimmune diseases like antiphospholipid antibody syndrome, inherited thrombophilias, or maternal diseases like diabetes or syphilis. Then coming to the counseling and investigations after recurrent abortions, it should be started soon after 2 abortions have been done subsequently. So first point would be collecting a detailed history about each pregnancy and the events occurred during the pregnancy. Next, investigations will depend on the gestation at which there was abortion and whether the fetus were viable or not. Some of the investigations will include karyotyping, investigations for cervical incompetence and uterine malformations, and investigations to rule out autoimmune disorders like checking for any autoantibodies, and screening for diabetes mellitus and syphilis and any of the infections. Then there will be advices should be given regarding future pregnancies, like on investigation any abnormalities if present, they should be corrected before planning for pregnancy, and the women should be advised to report to a doctor as soon as the pregnancy is diagnosed, because they may require treatment in certain conditions like apple or diabetes from the start of the pregnancy. And antenatal care should be given in a high risk pregnancy clinic, and they should deliver in a center with all the facilities available for both the mother and the newborn. So this is all about the recurrent abortions and recurrent pregnancy loss. Thank you.